When doing massage, I usually incorporate a variety of techniques that I have learned. They would include Swedish, which is a general relaxation, smooth stroking, and I often incorporate some deep tissue techniques on specific areas. If there's a real tight area on the shoulders or a trigger point, I may apply a little trigger point work, maybe a little sports technique. And I often incorporate quite a bit that I learned from the neuromuscular techniques as far as getting into a little deeper or positioning somebody or their limbs so that I can get into like the pecs, their shoulder and chest muscles in a different way. In addition, I may apply a little range of motion or stretching techniques. During the session or after the session, I often will speak with a client about some things that they can take home and do for themselves towards their own self-care. And that can include stretching, whether it's a stretch of the hamstrings or the quads, which often, those being tight, cause tightness in the low back. A lot of people come in for low back pain, but it's really being caused because their legs are so tight, their hips are locked up and causing the back to lock up. I will often give them stretches to do for their arms or their pecs. I'll recommend breathing. Sometimes this world that we're so stressed and fast-paced that we don't breathe. So I'm suggesting they can breathe, even if it's driving the car, you're at a stoplight. Take some extra deep breaths. It really helps for you to just bring your awareness back into your body and kind of slow you down for a minute. There's just a lot of options that I try to incorporate to help somebody take it home and not just have it on the table, but take it beyond.